to you and welcome to Adelante Chicago. I'm Lourdes Duarte. Thank you so much for joining us today. Bienvenidos. Well, this month, the state's Health Benefits for Immigrant Adults program ended. That left thousands of undocumented immigrants without medical care, the medical care they need. So what can these individuals do to continue to receive health services? Stephanie Wilding, Community Health CEO and also chair of the board of the Illinois Association of Free and Charitable Clinics, is here with some answers. Thank you for joining us. Hello.
Thank you for having me.
Okay, of course. Let's talk first about what your organization does for folks that maybe are not familiar with it.
Yeah, absolutely. So Community Health is the nation's largest volunteer-based free health center. So we provide primary care, specialty care services, especially for chronic conditions like diabetes and hypertension. We provide dental care, mental health care. We have a full pharmacy, and we also do health education classes. And all of those services are provided to low-income, uninsured patients at no charge, completely free.
Okay. In the meantime, just in the last few months, we have seen these cuts to medical services, right? And a lot of our undocumented who perhaps were relying on medical care through state funding have now lost that as of, I think it's July 1st.
As of July 1st.
Yeah.
Yes.
And I'm wondering how sort of communities are coping with that, what you're hearing from folks as a few weeks have passed now and people have had a chance to figure out what's going on.
Yeah, absolutely. We actually started to see some movement within the community even in advance of July 1st because we, along with many other community advocates, were really ensuring that patients knew that this was coming. And so starting probably around mid-June, we began to see more patients coming to our clinic, anticipating that they would lose coverage on July 1st and wanting to register to become patients. In some cases, these were our patients who had been with us before. And then they got health coverage, and so they went to a new place for their care that they may not be able to go to anymore. So now they're coming back to Community Health for that free health care. And in other cases, we're seeing a lot of new faces, new people who have not been Community Health patients before, but are looking to find a medical home where they can focus their health and wellness.
But when you think about how much was cut in dollars, I would imagine your organization can only go so far. I mean, we're talking about thousands of people who may be turning to you now suddenly with no health coverage, right? No way to pay for it.
Yeah, absolutely. And when we think about that, in Cook County alone, there's around 22,000 people who lost coverage on July 1st. To give perspective of impact, it's major. And so we really need to think about the entire system and what can support these patients. Community Health, as a large free health center right here in Chicago, is certainly able to step up with limitations. But there are actually nearly 30 free and charitable clinics throughout Cook County that can also step up and provide this care as well. Free and charitable clinics are really built to provide care for that uninsured population. And most of the care is either completely free or given at a very low cost so that patients aren't having to take on that burden. And cost is often, when you're uninsured, the most significant burden, paying for your medications, paying for that copay. So to be able to find a medical home where that is free or very low cost is a huge burden that's eliminated for those patients.
Okay, do you turn anyone away? I mean, I assume they have to apply and there are certain sort of things that they have to follow or guidelines that they have to follow, I imagine. Run me through some of those.
Yeah, so Community Health will see any uninsured adult patient up to 300% of the federal poverty line. And to give you some perspective, federal Medicaid measures the cutoff for poverty level at 138%. So Community Health's definition is more than double that. So that really ensures that there's a wide range of folks who are able to come and seek services at our health center. We have a patient registration process where patients have to provide, the documentation that demonstrates their income level, their family size, that sort of thing. But as long as a patient's able to do that, which could include a self-attested letter of the income that they're earning, then they're able to become a patient with us and receive all of their care for free.
And so we're talking about things that they would be treated for at your clinics, like diabetes, perhaps mental health. Are those all things that you address?
Yes, absolutely. So once a patient becomes part of our primary care medical home, they have access not only to their primary care provider, but also 20 different specialty care services. So for example, a diabetic patient could come to Community Health and see their primary care provider, but they could also see their endocrinologist, a podiatrist, and a nephrologist, which are all specialties that are helpful for a diabetic patient to maintain their overall health and wellness. But that same patient could also see our behavioral health counselor They could get their teeth cleaned with our dentists. They could also pick up all of their medication, including their diabetes medication, and also take a Zumba and yoga class as well to stay healthy and fit.
There you go.
Yeah,
there
all
you
for
go.
free.
All right. And so I imagine that you're in different communities, right? Because we've got so many neighborhoods in Chicago that have this great need, from Belmont Cragen to, you know, you name it. Where are you located?
Yeah, Community Health is in Humboldt Park, Belmont Cragen,
Okay.
Little Village, and Back of the Yards.
Okay, so those 4 communities, but people from anywhere in Chicago can
Absolutely.
visit.
We
Yeah.
don't have a restriction on location, and in fact, we see patients from every single zip code in the city of Chicago.
Okay. Bigger picture, I've got to think somebody's working to address this incredible need for dollars that there is right now for some of the undocumented, or perhaps just people who are low income, right? What's being done bigger picture to address policy right now that maybe you're working on? Or
Absolutely. The Illinois Association of Free and Charitable Clinics is committed to working along on other safety net leaders to really think of effective, efficient, and innovative ways to provide care for populations as they lose their coverage. This has been a recent change. We can also expect that there'll be other changes coming up that are coming down more from the federal level. And so the association is working alongside other advocates to think of creative strategies that will allow us to serve everyone as much as possible. And we're very grateful to the state of Illinois. Illinois is one of only a handful of states in the country that actually invests in the free and charitable clinic sector, providing us with funding, direct funding, to be able to provide care for this uninsured population.
I've got to think, though, your anxiety level and your worry level at this point with so much going on has got to be pretty great. Yeah.
Yeah, I wouldn't say it's anxiety. You know, Community Health for over 32 years has provided free health care to uninsured individuals. This is our purpose. And in a moment that feels uncertain, to be an island of safety for our patients, for the community, where they know they can come for affordable, safe, high quality care. In those moments of, as you mentioned, anxiety, that is what I choose to focus on, is that Community Health is an island of safety. We have been for over 30 years, and we will continue to be that island of safety for as long as we're needed.
You got to keep it going. Okay, we've got a website that you can visit if you're interested, if you need the help or know someone who may need the help, CommunityHealth.org. You can check out where to visit them, maybe the application process, things like that. And of course, ways to donate if you want to help the work that you're doing.
Or to volunteer.
Yeah, or to volunteer.
Yeah,
there
absolutely.
You go. All right, thank you so much
Thank
for
you
your
so
time.
much.
We appreciate you.